It's Medicare FAQ Friday. Hi, my name is Robert Bache. I own Senior Healthcare Direct, MedicareBob's office. My agents and I, we assist people with their Medicare nationwide. It's FAQ Friday, and for those of you that follow us on social media, YouTube, etc., you know that every Friday I post a new video answering a question about Medicare or sharing something with you that I think is very important for everyone to understand about Medicare. Well, the annual election period is here. It's going to start October 15th and it ends December 7th. This means you're already starting to see all the commercials, all of the stuff in the mail, you're getting phone calls, and they're trying to help you with your Medicare plan. I do think it's important for you to evaluate your Medicare options, but I just want to help you avoid the biggest mistake that people that you and I both know are going to make this annual election period. There's two main types of coverage that people can choose from when they're on Medicare. They can choose what's called a Medicare Supplement or a Medicare Advantage. Neither one of them are bad options, which is why Medicare can be so overwhelming, is because you really have two good options. If one was really good and the other was really bad, it'd be really easy to make a choice. But the reality is they both fit the right person depending on what your needs and what your wants are. But here's a mistake people are going to make. And it's the biggest thing that people don't understand this time of year. If you choose a Medicare Advantage plan and then later you want to upgrade to a Medicare Supplement plan, you'll be subjected to medical underwriting, meaning you may not be able to ever get a Medicare Supplement. The only time in your life you're automatically approved for a Medicare Supplement is when you first join Medicare. So when you first join Medicare, you have 6 months after that you are automatically approved for a Medicare Supplement plan. So if you are on Medicare with a supplement now, or you're on a Medicare Advantage plan now, and you're looking at your options for 2021, I would encourage you to really understand the differences between the Advantage and Supplement products. Because if you're going to either stay with an Advantage, switch an Advantage, or give up your Medicare and Medicare Supplement and go to an Advantage, just keep in mind that when you might want to upgrade back to a supplement again in the future, you may not be able to. See, Medicare Advantage plans are kind of like what we have with group insurance, all right? And it's actually lower premium. A lot of the plans are the same price as Medicare. You just have to pay the Part B premium, and that's why they can be advertised as zero premium. But the reason that it's the same price as Medicare is because it doesn't pay your bills and it limits your doctor and network and hospital choices. So it's not that those are bad, okay? But most people really like those plans, especially if they stay healthy. Common call we get this time of year is, I have a Medicare Advantage plan, I had to use it, and therefore I'm not happy with it, okay? So I'd like to upgrade to a supplement. Well, we say, okay, no problem, we'd love to help you. But since you used it, what was the health issue that you used it for? That's where the problem comes. Because they're like, well, I had a heart attack 4 months ago and I ended up paying $5,000 for it. And then I even had to go to some cardiologist that was in the network that I didn't really want to go to, right? Or that's just an example. So then we tell that person, look, I'm really sorry, but you're going to have to stick with the Medicare Advantage plan because most Medicare supplement carriers are going to require a 2 to 5 year stable health history from your heart attack. And that's just one example. So to be clear, I'm not anti-Medicare Advantage plan. I am pro education and knowledge. We will never sell you a plan here at Senior Healthcare Direct, MedicareBob's office. We will educate you, give you the options, tell you everything you need to know to help you make an educated choice. We do help people with Medicare Advantage plans, but they all understand and know the pros and cons to everything, which is one of them is if you go with an Advantage plan now and later want to upgrade, you may not be able to. So that's the biggest mistake that I want to help you avoid. Not just you. I'm going to challenge you. If you have other friends that you guys are talking about your Medicare choice this annual election period, I encourage you to ask them, do you know the differences between a Medicare Advantage and Medicare Supplement? And do you know that if you have a Medicare Advantage and later want to upgrade to a supplement, that you'll have to medically qualify? And if they don't, feel free to educate them or point them in our direction. We'll be happy to help them. So, again, if you're going to go with an Advantage plan, that's fine. Just understand that you may not be able to upgrade down the road to a Medicare Supplement. If you have any questions or you want to go over the pros and cons of Medicare Supplement and Medicare Advantage, just I'll put our phone number and our website on the screen and in the description below the video. And as always, you can follow us on Facebook. We have over 100,000 followers, and follow us on YouTube by subscribing to our page because we do post FAQ Friday videos every week and we keep you in the know when it comes to Medicare.